Hello everyone and welcome back. This is Munir Arab and today I'll be talking about planar radiography and CT imaging. So first I will introduce the different factors that determine the image quality in a planar radiography in terms of signal to noise ratio, spatial resolution and contrast to noise ratio. Then I will continue to show you different artifacts that can occur in CT imaging. Also, I'll be including examples from scientific articles for the two concepts. Stay tuned. X-ray planar radiography provides a screening for acute injuries like a bone fracture and suspected chronic diseases, for example in the case of cancer. A reminder, the basis of planar radiography is the differential absorption and scattering of X-rays within the tissues of the patient. The X-ray beam from the tube is collimated, passes through the patient, and forms an image on the digital detector placed below the patient. The three most common quantitative parameters used to measure the quality of an image are the signal-to-noise ratio, spatial resolution, and contrast-to-noise ratio. Factors affecting signal-to-noise ratio SNR. The tube current and exposure time. The SNR is proportional to the square root of the product of these two quantities. We usually see better signal as tube current or exposure time increases. However, at higher values, these images become darker. The tube accelerating voltage KVP. We can see higher SNR in the spine X-ray due to greater tissue penetration of the higher energy X-rays resulting from the higher KVP. The patient size and part of the body being imaged. The greater the thickness of tissue through which the X-rays have to travel, and the higher the X-ray attenuation due to bones, the lower the SNR. Factors affecting spatial resolution. Focal spot. On the left, a large focal spot size results in a wide zone of blurriness compared with a small focal spot on the right, which result in a sharper image. The relative distance between the X-ray tube and the patient. This example shows image distortion. This effect can be reduced by adjusting the distance between the X-ray source and the patient. Factors affecting contrast-to-noise ratio CNR. CNR is primarily affected by the scattering radiation, the Compton effect, and this is due to the X-ray energy spectrum. For low KVP values, the photoelectric effect dominates, and the attenuation coefficients of bone and muscle tissue, for example, are substantially different. If high energy X-rays are used, then Compton scattering is the predominant interaction, and the contrast is reduced considerably. The field of view, FOV. The proportion of Compton scattered radiation reaching the detector increases with the FOV, and therefore the CNR is reduced with the increase in FOV. The thickness of the body part being imaged. The thicker the section, then the larger contribution from Compton scattered X-rays, and the lower the number of X-rays detected. In this article of Weis et al. 2017, they show how the SNR increases after switching the accelerating voltage from 100 to 70 kVp, and this is visible in the lung CT images with non-enhanced contrast. So it's not always the case that KVP increase will improve SNR, because after a critical value of KVP, SNR starts to decrease due to increasing noise. Computed tomography imaging. Reminder, the physical principle of CT involves synchronous rotation of the X-ray tube and multiple detectors to record a series of one-dimensional projections. The CT image is then produced by the process filtered back projection. In CT, we encounter imaging artifacts. For example, beam hardening artifact. It appears as a webbing between dense regions in the image. As the CT beam traverses greater thickness of highly attenuating material, such as bone, the average X-ray energy changes. The X-ray spectrum undergoes attenuation and lower energy X-ray attenuated, resulting in a characteristic right shift in the spectrum. Streak artifact. In this image, we can see streak artifact from high density, high atomic number dental fillings. Streak artifacts occur when the attenuation levels of a region in the patient are excessive, which can exceed the dynamic range of the detector systems. The main source of streak artifact are metallic dental fillings, implanted devices, and bullets. View aliasing. Here we can see blurry image of a mouse head due to view aliasing. View aliasing is the term given to CT reconstructions that do not have a proper view sampling to render the sharper objects in the image. In this article by Huang et al. 2018, they constructed a deep learning algorithm with convolutional neural network to reduce metal artifacts in cervical CT images. They generated cervical CT images with simulated artifact to train and verify their model. The model was efficiently capable of reducing metal artifacts and improving the visualization with high peak signal-to-noise ratio equal to 38. And this is clear in the cervical CT images below. However, the study was done for different slices at the same contrast. So different contrasts should be examined to confirm the validity of the trained model. These are my references. Thank you for watching. Bye bye.